Hello and welcome to Thing of the Month. Join us as we take you behind the scenes of Barts Health Archives and Museums to reveal highlights from our collections. This curious-looking wooden head, which can be found on display in St Bartholomew's Hospital Museum, dates from the early 19th century. The head is marked to show the classical positions for trephining, or the practice of drilling holes in the skull, and was most probably used to teach students at St Bartholomew's Hospital Medical School. Trephining or trepanning is the oldest surgical procedure known to man and can be dated back to the late Paleolithic period. It was used to treat head injuries such as skull fractures, but also cases of epilepsy and mental illness. In earlier times it may also have had spiritual purposes. A typical trepan was shaped like a brace with a handle on top for turning and boring a hole in the skull. This style of trepan continued to be used well into the 19th century. Trephines, or trephines, were more sophisticated instruments than trepans. They were shaped like a T, with handles for gripping and turning the blade by hand, and they used a circular saw instead of a drill to cut and remove a circle of the skull. The name trephine originated from the Latin term tres fines, or 3 ends. John Woodall, a surgeon at St Bartholomew's Hospital during the 17th century, invented an early example of a trephine. Woodall's Handbook for Ship Surgeons, The Surgeon's Mate, first published in 1617, not only included details about trepanning and trephining, but was one of the first texts to advocate the juice of lemons, limes and oranges for the treatment of scurvy. Woodall claimed that trephine was safer to use than the trepan, although surgeons continued to disagree about this. Although we don't hold Woodall's type of trephine in our collections, we do hold a trephining set which belonged to the noted London hospital surgeon Sir William Blizzard. This set gives an insight into the instruments used for trephining around the time our wooden head was made. The case contains 2 trephines, as well as different instruments for perforating the skull and lifting out the bone. From the Renaissance until the beginning of the 19th century, trephining was widely practiced and was usually carried out in the home. The risks of brain damage, infection, blood loss and hemorrhage were always substantial. However, when trephining moved into hospitals in the 19th century, mortality rose exponentially due to the increased risk of infection. Consequently, the operation was only attempted in very serious cases of head injury. The practice was so dangerous, a saying arose that the surgeon himself must have a head injury to attempt to perform it. The wooden head was found in the west wing of St Bartholomew's Hospital in 1960. It probably came from the old anatomy theatre, which in the 19th century stood in a set of buildings behind the west wing known as Long Row. These buildings were later destroyed during the Blitz. As well as its use as a teaching guide to medical students, the head's scuffed and battered appearance suggests that it may also at some time have been used as a football. Eventually, the introduction of modern antisepsis, as well as an increased understanding of intracerebral pressure in head injury, allowed trephination to return as a common procedure in the management of head trauma. Today, craniotomy, as it is now known, is principally used to treat hematomas and to enable surgical access for other neurosurgical procedures. We hope you've enjoyed this video. We'd like to hear about your favourite item in the collections. You can search our online catalogue via the link below and follow us on Twitter and Instagram to tell us what you find.